Well, good afternoon, everybody, and welcome back to the United Regional Chambers Weekly Update. We try and bring you on some interesting guests and some subjects from around the area. Today, it's my pleasure to bring on Robin Cuddy. Robin is a consultant for the Community Health Systems Foundation. We're going to talk a little bit about the grant programs that the Community Health Services System, has ready for the general public. Just a quick background, the Community Health Systems, which formerly oversaw Community VNA of Attleboro, has become a foundation to support the health and wellness of the area residents. And again, my pleasure to bring on Robin Cuddy. Hey, Robin, how are you today?
Hey, Jack, thanks for having me. It's great to have the opportunity to talk about the great work of the Community Health Systems Foundation Board and the opportunity for the Community Health Systems Foundation to make an impact in the community.
Yes, and I'm a proud member of the board of directors. I was asked to jump on that board, and it's very fulfilling because of, well, we'll talk a little bit about some of these grants that we've given out, and you'll see, folks, how great of an organization this is. So Community Health System Foundation came into being when there was a merger between Community Visiting Nurses that's there on Emory Street and Hope Health. Hope Health is one of the largest healthcare organizations in the country. So this was formed. There was a little bit of money given that we can give out in grants, and Robin's going to talk a little bit about the grants today. So Robin, tell us first, what are these grants for?
Sure. So, Community Health Systems Foundations, because of its origin in a pre-merger, the Community VNA, as many people would know, it would provide in-home health services for folks in need. Aligned with that, the Community Health Systems Foundation really wants to support health needs for community residents. And so the grants that Community Health Systems has made and will make are aligned with health needs. The board has identified some specific areas of health that they have some concerns about. Mental health, as we all know, it's in the news. We hear about kids, families, individuals that struggle with that. So I know the board is particularly interested in the opportunity to make some impactful grants that might make a difference to folks that are struggling with mental health issues and health access. Maybe this is not something you hear as much about as in the news as you hear about mental health, but certainly when you talk to people who work in the healthcare industry and in that world, the access to quality healthcare isn't the same for all people. And those of us who maybe have financially more stable have better access, better care sometimes than those who don't. And so I know that Community Health Systems Foundation Board, yourself and others are interested in making some impactful grants in those areas as well.
Well, and I hope we can make a difference. I'm going to back up a little bit because I should have done this first. The board dragged Robin kicking and screaming out of retirement. But tell us a little bit about Robin Cuddy.
Sure. So, anybody watching this might say, Robin Cuddy, that's Robin McDonald. So, under my time at the Attleboro Y and my YMCA career, which spanned 39 and a half years, I was known there, married to Mark Cuddy, went from using my non-married name to my married name. So same person, different last name. But I retired in January of 22, but I didn't want to retire from, participating in important community work. And so having the opportunity to spend some time working with this board, it's just a great board of directors. If I could just give a shout out, Jack, to you, the board chair, Paul Linehan, Elise Servant, Lisa Piscatelli, Amanda Blount, Liam Timmons, Juliana LaRusso, and Thea Gomes, Kate Mangiarati, and Carolyn Dibbard. Great board of directors that has been a real pleasure for me to work with out of my retirement. And this is a nice opportunity for me to be fulfilled, to provide some help and support. It's important to me that the volunteers on the board are spending the time that they have to give thinking, being productive, and doing meaningful work. And so if I can do some of the legwork and allow you folks to have more time to think and make a difference in your contribution that way, then I feel like I've fulfilled what I am here to do. So, yeah, from the why to community health foundations, I always say all my friends used to run when they saw me because I'd be asking for money for the why, and it's kind of nice. So.
Yeah, so it's us now that have to ask for the money. Well, actually, we really don't. On this one, we don't, because we were given quite a bit of sum of money
That's right.
to spread out throughout the communities. So tell us about these grants and what is the purpose of us giving out this money?
Yeah. So again, I think the foundation board has honed in on, trying to improve the health of folks in our 13 community catchment area. As you know, Jack, our grants are focused on helping people have healthier lives who live in Attleboro, Dighton, Easton, Franklin, Foxborough, Mansfield, Norton, North Attleboro, Plainville, Rehoboth, Seekonk, Taunton, and Rentham. That's our catchment area. So when you or I refer to the 13 community catchment area, those are the communities that residents who live in those communities can benefit from grants that the Community Health Systems Foundation makes. As you know, we've made some grants in 2022. Coming up is our inaugural 2023 grant cycle. And we hope to make grants for programs. The board is specific that the grants are going to be for programs and services and projects versus, brick and mortar buildings and things. So a grant might be for somebody to have access to healthcare, somebody to have mental health services where they're not able to afford it. We've made grants around providing transportation for people who need to get to where they need to get to for healthcare. So, health is a very broad topic, as we know. There's certainly a lot of aspects to health, whether it's mental, physical, spiritual health. But, I think the board is focused on programming that is either evidence-based, it's already making a difference. We know that there's data that says there's a need in this area, whether it's food insecurity issues or, again, access to healthcare. Or the board, as you know, is also open to a grant that might be for something that has not been tested and maybe deemed innovative. We're open to that too. There's probably some solutions to some things that are happening in our community health needs that haven't been tried before, and we're open to supporting some of those ideas as well.
Well, we're very fortunate to be able to give out some of the grants in 2022. Can you give us a couple of organizations or examples of the grants that we gave out last year?
Sure. Yeah. So last year in 2022, Community Health Systems gave away about $650,000. So first, I would say we want everybody to know that this is a foundation that has the resources to make an impact. We're not, small foundation that is going to sprinkle the infield with a few $1,000s here and there. Our grants range from $10,000 to $50,000. The average grant is about $20,000. And in 2022, we had 2 rounds of grants, an inaugural grant where we gave 26 organizations funding. And most of that funding was allowed to be used for things that the organization would lift up that were the results of the pandemic. And so we had in 2022 quite a lot of grants that were supporting COVID needs. It could have been for PEP, it could have been PPE, it could have been for food, it could be for Habitat Humanity. We helped with resources for a home to be built. We provided funding for YMCAs to provide food in the terms of groceries or hot meals to seniors. So in 2022, the inaugural grants were mostly pandemic-related things that organizations were addressing. And then later in 22, in November of 22, The board was very concerned with the impact of inflation on families being able to pay rent, mortgage, fuel costs, and food costs. And so 5 organizations received grants that really those 5 organizations agreed to pass those funds on in terms of in the way of rental assistance, fuel assistance, food assistance, either in gift cards or actual groceries. So, that those 2 grant cycles in 22, I think, were somewhat unique. COVID impact, lots of organizations getting an opportunity to address some of those things. End of the year, inflation, we saw it everywhere you went, people struggling to purchase food, gas bills, heating bills, electric bills, much higher than those may have been in the past. And so the foundation was concerned with that and made $250,000 worth of grants that were basically passed through. That was 2022.
So now we've moved into the 2023 grant cycle. Tell us a little bit and give us the timeline that we have set out.
Yeah. So where are we headed with grant making? And as you know, Jack, you have the enviable position of being the chair of the grants committee. So
I don't know about that.
So far, so good. Job well done.
Yeah.
But we did a strategic plan, as you know, this year, and we did it specifically so that we would really be able to focus our work and our funds in areas that were of concern, and hone in a little bit more closely to the health needs and health services and health programs. So I think that what folks will find, the next round of grants will be aligned with our strategic plan that says we really want to make impactful grants for health needs. The grants, again, they'll range from $10,000 to $50,000, with probably $20,000 being an average. I'm excited to say that we launched applications on Monday of this week, March 13th. The application is available on our website. So folks that are interested in applying can go to our website, and I know they'll have the opportunity to see that website on the screen. They can go to the section called Grant Guidelines, and they can actually download the information, the timeline, the instructions, the application. And then they'll learn when they do that the grant cycle is open for applications as of Monday, that there's a question and answer period, which is very specific. So if somebody out there is going to apply for a grant, best that they go online, download the application, download the instructions, read through them. If they have questions, those questions would be directed to me at chsfoundationma@gmail.com. And that email address is also on our website. And those questions should be directed to me via email between March 14th and 24th. You might say, what kind of questions would somebody have? They might have a question about, could this be a multi-year grant? The answer to that is in the grant guidelines. It could be. We'll consider multi-year grants. It's not the typical grant that we would make, but we would consider them. They might want to know, do they have to spend the money in the next year? Is there a grant report? So if these questions come up as they're reading through the application, they can send me an email between March 14th and 24th. I'll get right back to them with an answer. And then they'll proceed with the application process. And when they go through the application, they'll see again in the instructions that the applications are due on Wednesday, April 12th. They're not to be sent to me or CHS per se, because we have a partner in Bank of America that facilitates our grant making. And so on the grant application and online in the instructions, it says, mail them to Bank of America, email them to Bank of America. It gives 2 email addresses for them to go to. And grantees should know that they'll get a confirmation from Bank of America that, yes, we did receive your application, and they'll know that it's been received and will be reviewed. So those are the key deadlines. Open now, question and answer March 14th to 24th. April 12th is when they're due, the applications.
So if you have a question about, do I qualify for this grant? Would my program qualify for the grant? Please reach out to Robin, because she will be able to answer those questions directly for you, save you a lot of time, save you a lot. Robin has designed the application. So a simple way to say it's fill in the blanks. And it's very, very simple process. As a lot of you grant makers know, or grant writers know, some of them can be very, very complicated. That's one of the reasons why Robin has been involved. She's simplified it for all of our grant people that are applying. So if you have a question, please reach out to Robin. Now, one question I have is, okay, I've applied. When do I hear?
That's a good question. So we partner again with Bank of America. They'll help us sort through the applications that we receive. So between April 12th and probably early May, our grants will be in the hands of Bank of America as they sort through them. We don't know how many exactly to expect. I think the first round of grants, there were 26 grantees and maybe 30 applicants. So you can imagine if we have 30 applications, we need to coordinate the process of reviewing those grant applications. And so Bank of America will have the applications from April 12th for 2 to 4 weeks. And then our committee and our board will, with your leadership, Jack, we will review those grants. And as you know, we have an evaluation tool that we'll use that will help us rank the grants and see how they align with our priorities. And then by June 1st, it's our hope and our plan that all grantees will hear the results of our rating and whether they'll receive a grant award or not.
Awesome. Well, we're starting to wrap up here a little bit. We try to run this through pretty quick. Is there any last thoughts or things that you'd like to tell the folks, Robin?
I would just tell them, again, as you reiterated, Jack, reach out with questions and reach out early. And I'm more than happy to help people strengthen their application by making sure that they know whether or not what they're thinking from a standpoint of a program or service might qualify. That's one. Two, if they see any of the folks that I just mentioned earlier that are on the board, thank them for their time and service, because it's extremely valuable. And certainly we wouldn't be able to do what we do without you folks.
Well, I have to thank the other members of the board, because I certainly don't do this alone. With your assistance and your guidance, you know, we had a very healthy program last year, and it's going to continue to do through 2023.
Yes,
So, Robin,
sure.
thank you once again for taking the time to come on the show today.
Yeah.
We're going to share this information out. So, and folks, if you know of any organization that you think might qualify, ask the question. You know, send Robin a quick email. She gets back to you very promptly, and will tell you yes, no. We can do it this way. We can do it that way. It's a pretty simple process, and we hope to be able to help a lot of the organizations within our 13 communities in the catchment area.
Yep. So Jack,
Robin
if
Cuddy.
people are, again, for email, it should be chsfoundationma@gmail.com.
There we go.
Perfect. That's
And
it.
a big shout out and a thank you to James and all the troops over there at AACS for putting up with me every week. And all the little
Thanks,
glitches that
James.
we have.
Yep.
Robin Cuddy, thank you for taking the time today. Hang on just a minute. We're going to close out the show. James, thank you very much. Folks, see you next week. Everybody,
Thanks,
please
Jack.
be safe.
Appreciate-
Bye.